Well, we're here today with Dr. Limongelli, a dentist from Yonkers. Dr. Limongelli, hi.
Hi, Mr. Flash.
Dr. Limongelli, tell me, in terms of being a dentist, for us patients, a dentist is a dentist is a dentist, and yet I'm very sure that different practices have a different philosophy. Like some, they concentrate completely and utterly in one particular area. I guess they're called specialists. Other ones do just about anything under one roof. And even under those people are still different, a different type of doctors. Some concentrate very heavy on cosmetic only. They do everything, but they, cosmetic. They want to put a Julia Roberts and a Tom Cruise smile on everybody. And while that is a nice thing, especially in an economy like today, not everybody, number one, wants it. And even if they want it, they don't necessarily have the money. It's like, you might want a Ferrari or a Mercedes, but a good, decent Honda will just satisfy you, and you realize that you definitely will get wonderfully safely around. Same with dentistry. There is safe dentistry. There's dentistry which creates functionability. In any case, tell us a little bit how your practice functions. What is your main driving philosophy? And maybe Dr. Limongelli, you can even tell us how you and why you became a dentist.
Well, I always like to work with my hands and help people, and that's what got me into dentistry in the first place. I started out as a general dentist, and I specialized in oral and maxillofacial surgery. I did oral and maxillofacial.
That's kind of the guys who do the heavy wisdom teeth and that type of stuff, right?
Yes, and not only that, but they do traumatic jaw deformities as well as developmental jaw deformities. I had a practice of that nature for well over 15 years. And after that, I went back into general practice again. I wanted to be able to do everything, not just surgery. So the practice I have now is very practical in that we do just about everything. We do a lot of crown and bridge and surgery and restorative dentistry and cosmetic dentistry as well. A lot of my patients have unions and third-party insurance, and so most of our dentistry is of a very practical nature.
And by practical nature, basically we're talking fixing the mouth so that it is obviously cosmetically nicely acceptable, and that at the same token, you don't have infections in the mouth, you don't have, be it a cavity or be it, that type of infection which eventually will basically, make your teeth rotten and fall out and or functional in terms of like, that the mouth is aligned in a way that the teeth are aligned in a way that don't give you headache, back pain, muscle aches, things like that. Is that what you mean by practical?
That's exactly right.
Okay. Well, all right. And did you tell me, you said you wanted to work with your hand, and that was one of your main decisions that you became a dentist. That's kind of like it fit you well?
Yes, that's true. That's true. I've been doing it for about 40 years, and I'm doing it very well, and my patients are happy with it, and I'm very happy too.
Well, dentistry, like many professions, but in dentistry I think it shows very well because after all, the smile, it shows. It's all about showing something. But while dentistry is extremely scientific, and probably it's the most scientific, predictable medical field out there, period. Do you understand? When you guys say you can fix something, it's almost 100% given. But when you have appendix, it's not 100% given. When you have a cold, it's not 100% given that it goes away. But when it's dentistry, it's about as predictable as any medicine can possibly get. Would you agree with that?
It's very predictable. That's true.
Yeah, and yet it's extremely artistic, isn't it? It's not about the tooth being exactly 2.5 millimeter this way and that way, which is important. But for some reason, even if the measurements are 100% correct, you can look at it and like it or not like it, and that's where the artistic part comes in.
It is both an art and a science. That's true.
Yeah, more so than most other profession, even though it applies to many professions. Well, all right. And so you basically do just about everything in your office. I know you see children, and you do periodontal disease, gum disease, and all that stuff. You obviously do teeth pulling, and you do, oral surgery, since that's your specialty. And that comes very close to periodontal, because both of you, periodontists and oral surgeons, are both heavy surgically oriented. You do veneers, crowns, lumineers, you do dentures, you do implants, again, because all surgeons are some of the most qualified people to do an implant out of oral surgeons and periodontists are the most qualified ones to do an implant. Many general dentists send the implants to an oral surgeon. Am I right there?
Yes, there you are. Mm-hmm.
Yeah, so you have all that captured. You do teeth whitening and bleaching, and you do sleep apnea, and
yes, we do.
Exactly, and all that stuff. Well, wonderful. Thank you very much for giving us an insight to your practice, Dr. Limongelli.
More than welcome.